The best way to treat nerve issues is figure out where the pressure is on the nerve and take the pressure off. The best way to conceptualize that is using the disc model. Your spinal discs are likened to a donut or a balloon filled with sand. So if you bite down on a donut, where does the jelly go? It goes out the back, out the sides, wherever you didn't bite. That's kind of the way our discs operate, but the jelly stays within the donut, like a balloon filled with sand. So if I squeeze down on a balloon, I move that sand to the other side of the balloon, I distend the balloon, but the sand stays in the balloon. That is the case for 99% of disc issues. The jelly stays in the donut, the sand stays in the balloon. That distended side, though, now gets in the way of the joint, and the joint is the vertebrae. So now your vertebrae, so let's say I have too much sand out to my left side. Now I can't bend to my left because that sand is in the way. Also, that sand is pressing on nerves. And wherever that nerve goes, that signal will be diminished and will cause problems. And that nerve could go to your knee, it could go to your foot, it could go to your heart, it could go to your liver, it could go to your lungs, it could go to your intestines. That's why so many people that we're seeing with a problem at like the T12, L1 area of their spine, the area that goes to your intestines, are having symptoms like Crohn's, ulcerative colitis, and they're getting misdiagnosed with these, and it's not this underlying inflammatory condition. It's a problem with the nerve. The signal isn't getting to the intestines, which are muscles, and they need to contract to move waste and blood through them in order to heal, in order to work optimally and properly. And if you just restore that signal, you restore the normal function. So the best way to treat a nerve is to take pressure off of it. The best way to take pressure off of it is to figure out where the pressure is, why it's there, and then the nice thing about the disc is that if you squeeze down on that side that's distended, you can move that sand out of the way. Now you can move the joint. Now there's pressure off the nerve. Now the patient is better. Now, wherever that nerve was going to, let's say it was going to your thigh, now you can properly strengthen your thigh. Now all of those exercises that you've been trying to do that were either painful or weak, now not only are they easier because they're not painful, but they're easier because you have the ability to contract the muscle. Now you have the ability to fully contract the muscle. Now you can properly strengthen it.